Good morning from Trinidad and Tobago. Today's date and this time I would like, for my own benefit and for those who would want to be solemn, as some of us are at this time for one reason or the other, permit me to read for you the single verse from the book of Isaiah 26:20, it being so apt to what we are doing now in the context of the more things change, the more they remain the same. It says, Isaiah 26 verse 20, the same verse I read at the National Day of Prayer. It says, "Come, my people, enter your chambers and shut your doors behind you. Hide yourselves for a little while until the fury has passed by." This is as fitting today as it was many thousands of years ago. Ladies and gentlemen, I want this morning on behalf of my own family and myself to thank all those citizens at home and abroad who have been generous in their expressions of comfort and condolences to me during a period of bereavement. I was fortified by your comments and the fact that you took the time to type and send to me and my family. It was not easy, and I understand very well it's never going to be easy for some families not to be able to even visit sick ones who go into the hospital and in some instances would pass away and they not be able to get the body to conduct a funeral. And even if they do, the funeral is as skeletal as it could be. 5 persons in a funeral is a kind of torture, but we have to undergo it to ensure that we don't give the virus any opportunity to treat us to further instances of bereavement. I want also this morning, on behalf of the government and all the people of Trinidad and Tobago, to continue to express our sincerest thanks and appreciation and dependence on our frontline caregivers, those who are in the front line of treating with the preparations, treating with persons who are healthy looking, but who may be sick, who may be carrying the virus, to whom they may be exposed, and for those who are providing care and attention at all our institutions around the country, and those who are searching the country for primary, secondary, tertiary, and other persons who may, knowingly or unknowingly, be facilitators of the spread of this virus. I want to let all these workers and their support staff know that we are dependent on them entirely, as a matter of fact, and that the job they are doing is a job that we can't do for ourselves. In expressing this thanks, we are not naive. We understand that in our population, there will be persons who will seek to exploit these vulnerabilities. But we trust that whenever that happens, the wider public interest will prevail in the shortest possible order. We welcome to that group the postal workers, who very soon in the next few days would be those persons who will take to the people that we are providing financial help to. The postal workers will join the brigade of essential staff to take to these citizens the elements of financial comfort and support that will go to those who have qualified and would be receiving those checks from the Ministry of Social Development. So we welcome them to the army of the people of Trinidad and Tobago who are dependent on those members of staff. Ladies and gentlemen, in the last few days, I personally and many members of our staff in this healthcare business have been speaking directly to or seeking to inform ourselves from persons who are in the belly of the beast in other countries at governmental level where decisions are made by governments, and at hospital level where doctors are literally winging it, identifying for the first time and still not knowing where this thing is going and where it's going to end. What we have been seeking to do is to benefit from their experience as to where they were, where they are, and where we are going in the fight against this same virus, whether it's in Trinidad and Tobago, in Italy, in London, Louisiana, or New York. We are all fighting the same war, and therefore it is valuable to know where we are. It's important to know that except for Japan and to a lesser extent Korea and China, no country has declared itself free of this virus, and the three countries I just mentioned have not done so, but their infection numbers have been reduced, so their curve has turned down to lower numbers that they could believe that they've passed their worst. No country in the world has declared itself free of this virus, the microbe having been identified within their border at some time. What that means is that nobody is in a position to tell you at this time what the end game is with the progression of this microbe. That having been said, the best we can look for scientifically at this time is what changes have been made in societies that are affected along the way, 1 month after, 2 months after, 3 months after, what changes have been made and where we are on that change curve. Today, the Ministry of Health will indicate to you where we've been in the last 24 hours and where we are since we have first been identified with it, and what our concerns are with respect to the progression. One of the things that bothered me all weekend as I talked to people who have been dealing with this situation in other places is the answer to a question. When did you discover that you had lost control of this situation and you have moved from being in control to it being a worst case scenario? And let me repeat that. The question is, in areas where some of the best facilities are available, some of the best preparations made, and the outturn is not good, not to mention those who were not prepared, and the outcome is bad from the beginning. But the question is, when did you discover that you had lost control and that the situation was spinning out of control? And the answer I've been getting is that there's a horizon of 72 hours, about 72 hours, meaning about 3 days. So one day you think that things are going well according to plan and the numbers are manageable and the numbers are small. Day 2, it accelerates to something differently. In day 3, the acceleration continues, and by day 4, the acceleration would have been such that you realize that you're being overwhelmed, and it just gets worse and worse until you get to the peak, the worst case scenario. Bring that home to Trinidad and Tobago. Our question that our technical people are going to try to answer and that the government is going to respond to is, where are we? And as a result of these discussions and the advice that we have been getting from our technical people, because we have said from day one, the government of Trinidad and Tobago will take whatever action is necessary based not on fashion, not on whim, not on fancy, but on the scientific assessment of our professional staff who are the experts in public health care. Today, I want to indicate the changes I hinted to when we last made arrangements. I said to you, we will evaluate our position a little way down the road, and we'll make the necessary adjustments as required. When I spoke to you last, asking you to stay at home, I said to you that the stay home, except for essentials within the essential group, that will last until the 15th of April. Clearly, we are not going to be in a position at the 15th of April to be able to tell the population that you can come out and go back to some semblance of normalcy. It is the other way around. We expect that by the 15th of April, it is quite likely, certainly possible, that we may be in a worse situation than we were on the first of the 15 days that we started out with for stay home. So today, the government takes the position that the stay at home will go until April 30th, and we will take additional action to intensify the compliance of that instruction. Not relax it, intensify the compliance, because that is what is required to deal with the problem that we are dealing with. It is not a question about preserving your comfort zone. It is not a question about preserving your earning capacity. It is not a question about equalizing co-ethnic behavior. It is not a question about accepting and exploiting political opportunity to create mayhem. It is simply a question of whether we live or whether we die. Effective immediately, the government is recommending that persons who are in public wear masks over their mouths and nostrils. The government intends to implement programs of distributing masks to members of the public, and the Ministry of Health and other relevant government authorities will speak to that after this morning's press conference. Hardware stores, including electrical and plumbing establishments, will be permitted to open from hours of 8 a.m. to 12 noon, Monday to Saturday. Retail services, such as discount stores, markets, supermarkets, fruit stalls or shops, vegetable stalls or shops, bakeries, and parlours which provide food or medicine or other necessities of life, will be required to close to the public by 6 p.m. daily. Wholesale stores for provision of food, medicine, or other necessities of life will be required to close by 4 p.m. daily. Pharmacies will be required to close to the public by 8 p.m. daily. Services relating to food and beverage which are permitted, takeaway and delivery food service operations, will be required to close to the public by 8 p.m. daily. And there is to be a continuation of the order that at all of these facilities, there is to be no in-house dining and consumption around. The previous regulations permitting to the conduct of religious and ecclesiastical services or other religious gatherings where 10 persons were permitted to participate will now be reduced to 5. These instructions come into effect, come into force with effect from tomorrow, Tuesday morning, at the appropriate time as outlined here. Tuesday, these come into effect. Ladies and gentlemen, I want to just point out that we are not naive. We are just optimistic. We know that in all of these complicated arrangements, these changing arrangements, there are those among us who will see opportunities in furtherance of their own agenda. While we're no longer a British colony, we're part of the Commonwealth of Nations, and the Queen remains the head of the Commonwealth. What did she have to say on this matter? I draw one comment that she made in address to her nation and by extension the Commonwealth, she being the head of the Commonwealth. She said to all of us through Britain that this thing is going to be over. While all of us are now called upon to be responsible and to behave in a particular way to save ourselves, there's going to come a day when we'll have to look back on it and ask and answer to others, what did you do during the pandemic to save the nation, yourselves, others, mankind? What did you do? And that is the question that I today put to every citizen. And if your answer is that I complied with the sensible regulations outlined on a daily basis, or that I was too smart to comply, that I was in quarantine because the experts felt that I posed a threat to the national community, and I was in quarantine so as to prevent the possible spread of the virus from my body to others. But I, being too smart, I escaped from the hospital. Or that I knowingly exposed the staff at the hospital, the doctor who examined me, the nurse who handled me, the people in the waiting room who didn't know that I knew that I was a great possibility of being a carrier because of my own exposure. If that is your answer to the question that the Queen asked, then you pose a threat. And it doesn't take many people to overturn all that we have sacrificed for so far. There are those who believe that inciting disturbance under the premise that you are defending people's rights, I simply want to say to them that we know this. We know where this is going to end if you are allowed to succeed. Because there was a time when Hansen's disease, which is commonly called leprosy, were treated in a similar way. And the lepers had to have a bell that they rang so that anyone hearing the bell will get out of the way. And a person with such an affliction was treated with the worst of human behavior. Fortunately, over time, we realized the mistake, and such persons are treated differently now. And if you believe that we can manage this crisis, and everybody takes the position, not in my backyard, I simply want to ask a question. When you come down with it, or your mother, or your sister, or your child, whose backyard should we put you? If you can answer that, you'll assist us. In the meantime, the government of Trinidad and Tobago continues to rely on the professional conduct of all our staff in the Ministry of Health and the associates of the Ministry of Health to determine how we manage the situation. And what we call for from our population is compassion, humanity, common sense. And as Lloyd Best would say, anybody who encourages you to do otherwise for agendas well known to you, them is people to watch. I want to turn the floor over to the Minister and his Chief Medical Officer, who will continue to update us as we continue to fight.
Thank you very much, Prime Minister. Good morning, ladies and gentlemen of the media, and good morning to Trinidad and Tobago. Prime Minister, first of all, I would like to thank you for the leadership you have shown, and that the comfort that you have given by reading the Bible passage from Isaiah is very apt. Prime Minister, also healthcare workers who I have reached out to and who have reached out to me have extended their heartfelt thanks to you for not only your leadership, but also for recognizing the excellent work that they have done. And I would also like to add my personal thanks to healthcare workers, not only in Trinidad and Tobago, but in the Caribbean and around the world. They continue to be the unsung heroes in this global pandemic. I will now give my usual status update. The cases globally as at 10 a.m. this morning, 1,288,319. Deaths have risen to 70,567. But I also give at these press briefings what is the global caseload per million population. When I first started giving this statistic about a week ago, it was about 102 cases per million population. Today, April the 4th at 10 a.m., it is now 165.3 million cases per million. That means it has increased in a week by about 60%. A 60% increase when you boil it down to cases per million population. That should shock us out of any sense of complacency that we have had. In Trinidad and Tobago, samples tested so far, 833. Positive cases as at 10 a.m. this morning, 105. But as we take out the cruise ship cases of 49, which is an anomaly, you are left with 56 cases. Deaths so far, and unfortunately, are 8. And all of the deaths so far have occurred in the at-risk population, that is, the elderly with pre-existing conditions. So we seem to be following the global pattern, the global norm, where the 99.9% of the deaths are in that age category with pre-existing conditions. And discharges today are 1. Prime Minister, with your permission, I want to just touch briefly on 2 other items. I started to raise the issue of guidelines to be issued for homes for the aged. I raised it on both Friday and Saturday. I am happy to tell the population the guidelines have been in fact published in one of today's newspapers, and they will be published in all 3 newspapers online, and we have made it available to long-stay owners and operators of long-stay homes. Please learn from the example of Italy and other places where, unfortunately, bodies are taken out by the 5s and the 10s and the 20s in these long-stay homes. We do not want our elderly to succumb to this. The third and final item that I want to raise, and it gives me no pleasure to raise this one, Prime Minister, is the issue of the panic buying of the drug chloroquine and hydrochloroquine in Trinidad and Tobago. Let me say up front that there is absolutely no scientific evidence that chloroquine or hydrochloroquine, either by itself or in combination with azithromycin, can be used safely and effectively in the treatment of COVID. However, what has happened in Trinidad is that because of panic buying and the exhaustion of stocks in the private sector, patients suffering from malaria, rheumatoid arthritis, and lupus cannot now access that drug, which is life-saving for them. Not only that, the price at the retail level was taken from $3.20 per tablet to $10 per tablet. I want to ask pharmacy owners and pharmacy operators that price gouging in a time like this is not how we behave. The patients who have been sustaining you, patronizing your retail outlets over the years and decades, buying this drug at $3.20 to treat malaria, rheumatoid arthritis, and lupus, they are now coming to you as faithful customers, and they are now faced with 2 things. 1, price gouging, from $3.20 to $10 and now no stock. We have now placed those three categories of patients at risk. And having chloroquine stored in your house for which you have no use, for which you don't know how to use it, and if you attempt to use it, creates a danger to you, but it is now hoarded in your homes. And the three categories of patients, I want to say it again: malaria, rheumatoid arthritis, and lupus, cannot access this drug. That is what panic and hoarding does. I have reached out to the president of the pharmacy board this morning, Mr. Andrew Rahman, to enlist his assistance to appeal to his membership, and he has promised to do so. And I salute Mr. Andrew Rahman this morning for working with the Ministry of Health to ask patients, to ask people who have inadvisedly bought this drug to return it to the pharmacies, or go on to the websites of the lupus associations. You have Lupus Foundation, Voice of Lupus. Contact them and make the drug available to those patients who need it more than you. I am also appealing to pharmacy owners that at this time of concern, it is not the time to capriciously raise your prices. We are our brother's keeper in all of this. These patients will have a very bad quality of life if they cannot have access to this drug. It is useless at home. Return it to the pharmacies, please, and make it available to the patients who need it. And I will end by saying you could contact the various organizations on their Facebook pages that treat with lupus. It's a very close community. It's a very serious community. It's an autoimmune disease. They need the drug more than the individual who has hoarded this drug at home. So, Prime Minister, those are the three things I wanted to address this morning, and I thank you.
We'll have CMO Roshan Paraknam now give us his in-depth report.
Good morning, Honorable Prime Minister, Honorable Ministers, members of the media, members of the viewing and listening public. In terms of the clinical update for today, the 6th of April 2020, we have a total number of 96 persons hospitalized at this point. One new case was admitted to Cuba last night. In terms of Cora, there are 26 patients who are doing very well. They have minimal symptoms. Of that, we would have noted that 17 persons were recently transferred into that group from Cuba a couple of days ago. In terms of Cuba, there are 70 patients. Of the 70 patients, 66 of the 70 are doing very well. They are very mild cases. We are actually in the process of earmarking another 14 persons to be taken out of that facility within the next couple of days, and the remainder of the 66, if they continue to do well, will be taken out of Cuba as well, which would leave a very small number of persons in Cuba needing any sort of critical care. There's only one person requiring ICU care, 3 persons requiring high dependency unit care out of the lot. If you go back 2 days ago, there would have been about 12 persons in the high dependency unit. So those persons would have now been doing much better over the last couple of days, and they are actually back in the normal wards. So there's significant improvement in terms of the status of the patients at Cuba. In terms of Balandra, we have 22 persons that continue to be negative. There are no additional symptoms with any of them today. They are coming close to their 14 days by the end of the week. Once no one develops symptoms in that cohort, they too will be able to be discharged completely and actually go back home to their families. So it's something that we're all keeping our fingers crossed that they remain well. They are being well isolated. They have personal protective equipment on and being monitored twice daily by the staff in Sandy Grande. And we're really hoping by the end of the week we can get those 22 people home to their families. So there's some positive news in terms of the clinical update. In terms of the way the epidemic has been progressing, what we're seeing now, Sunday midnight would have marked 14 days in terms of the end of the, from when we close the borders. The 14-day incubation period is a critical point. So basically what we expect to see, we don't expect to see people directly linked to travel becoming positive. What we are seeing now is persons who would have been in contact with people that would have traveled, as well as the primary contacts of positive cases, which is what is coming back from us from the labs. There are a couple of people that we would have listed in our press releases as saying for epidemiological review. I would have spoken to the CEO of Southwest Regional Health Authority, and he assured me that the majority of them, except the last one, which is being investigated, has been linked to either travel or travel-related, which is very good news. But there are a couple of persons that are being investigated. There's one in Tobago, one in Trinidad, that I believe may be the hint of local transmission, and that is where my concern lies. Once you have any local transmission, what we do next is we do primary, secondary, tertiary contacts. We're creating rings of protection around that person to ensure that there's no local pockets of disease that are occurring, to avoid us going wider into community spread. And the restrictions, the tightening of the restrictions would aid us greatly once people abide by the stay-at-home order, to actually keep those rings as tight as possible. Even if we get small clusters, we can prevent the spread from the rest of the population. So the new advice, as we have said a couple of days ago with the guidance of CDC, for everyone to wear masks continues, as well as to stay at home. Okay.
Thank you, Dr. Parson. Let me just rectify an error I just made, a very important error. So I'm rectifying what I just said to you. I said to you about services related to food and beverage. I didn't give you the latest position. That was our position 48 hours ago. I have to give you our position this morning, arising out of what Dr. Parasham has just touched on there, our concern for the existence of incipient community spread. Our analysis, very latest, dealing with those who have gone that road, is that this is the point at which we could lose control, because we do not know how many persons out there, who they are, who might be in that category of non-travel. But we do know that they are out there. And statistically, and our general database indicate that we need to be concerned about that new development. To head that off, and in keeping with the tightening I spoke about earlier on, we are today closing all restaurants until April 30th. So what I said about the arrangement for collecting food at restaurants and so on, please disregard that. We are not permitting food services of any kind until the 30th of April, meaning that persons who would have got their supplies from those arrangements, you have ample time at home to prepare your own food. But more importantly, we remove a significant number of people from having to come out to get it. We are asking the population to come in and stay in until April 30th. That is how, and that comes into effect from tomorrow. That is how we are aiming to not walk a road that others have walked because they've missed this milestone. If you have any questions on this particular point at question time, please raise it so we can continue to clarify. But this is the most important point. We are taking steps to put more people indoors in the next 14 or 15 days thereabouts until April 30th. And of course, that brings me to a point. We did say that schools, we had made the restriction for schools until the next term was supposed to begin on April 20th. Well, it automatically means now that schools will not reopen on the 20th, not at least by the 30th, and sometime after today, the Education Ministry and the clientele will determine what possible day that opening will take place. And also, the SCA exam, which we thought might have taken place in May, that now has to be reassessed to see whether another time can be had and what that time might be. So I wouldn't give you that this morning on the podium, but that is coming. You'll get that information in short order, because those two dates, a date for the exam in May and a date for possible school opening in 20th of April, those 2 dates are now vitiated, as you would expect. So, having said that, I don't know if the Minister of National Security has any update. Failing that, we go to questions. You might have questions. If you do have questions for the Minister of National Security, he's here and could take the podium on that. So let's go straight to questions then. No questions? Thank you very much. Okay, let's wait. Let's start with...
Mr. Prime Minister, just Rowley from CNC3 News, right? Not on the COVID-19 topic, but we're seeing the recent rise in tensions between the...
Let's hold that for time. Let's finish. Let's focus on COVID first, and then we'll go to non-COVID items after. Any questions? Yes, over here.
Questions actually for...
Could you just tell us in the...
My question's for...
What's your name?
Crystal Wilson, TTT Limited.
TTT, Crystal Wilson, yes.
For the Chief Medical Officer, please. Morning, Mr. CMO. With regard to the release of patients, or
Sure.
the pending release, is there any specific procedure, requirement, post-discharge, anything dietary? Do they have, are they expected to have follow-ups?
Yeah, so generally our discharge policy as it stands is you have to be 7 days asymptomatic. You do 2 negative tests. Once those are negative, we're still asking people to quarantine themselves for a period of 7 days, past or asymptomatic. It depends. It has to be a case-to-case sort of discussion that they have to have with the dietitian and their personal physician. There are some people who would have comorbidities, for instance, pre-existing lung disease. The international research has suggested that there's some decrease in your lung function for a short while after, so they will have to have some sort of respiratory physiotherapy. Of course, with diabetes and hypertension, they need to have dietary controls, but for each patient, that will be done through the offices of either the medical chiefs of staff or the CMOH to ensure that they get the proper follow-up as they go.
One other question. I understand that there's someone who received a call from the Cuba facility regarding an MRI that they're supposed to have this week. Is that in fact taking place, and that person is, expressing some concern?
So the MRI and the other radiology tests have been suspended in the Cuba facility out of an abundance of caution because we have COVID-positive patients on site, and we're trying to limit the amount of non-infected persons coming into those facilities. So the other arrangements put in place by the RHAs, either having it within the RHAs or through the private sector, is being put in place to deal with the cohort that would have been going to Cuba.
I just wanted to ask you a question, Seattle. There is usually a position, that at least I know of, that elderly people who go on ventilators
Right.
they don't come off of it. That's the sort of general, I don't know if I'm right.
Well, generally speaking, in terms of COVID, the elderly population is the greatest at risk. Statistics coming out of Italy, when you go 60s, 70s, and 80s, persons over 80 years of age having COVID, the mortality is up to 24.5%. So there's a high degree of mortality with or without ventilators. Some early research suggesting use of ventilators, there's a high, once you go on a ventilator, the mortality rate increases significantly. Right? So there is a significant degree of mortality. So once you have the need for ventilator, it means that the degree of illness is very severe. So it does increase your risk of death.
Have we had any cases of patients that have gone on ventilators and had a successful outcome?
There have been patients that actually reverted, the ones in HDU, high dependency unit, and ICU, that actually did very well. I think they would have had one patient that actually improved after being on a ventilator so far.
Are you worried about the death rate?
The death rate for Trinidad is a bit skewed. Our population that we have been getting, especially from the cohort that would have traveled abroad in that large group, would push the age in that demographic to over 50. So the demography of the actual population that we saw as positive in Trinidad is skewed to the upper part of it. So there are more elderly people that would have formed the positives as a base. So I think scientifically it is difficult to use that group of people to base our judgments because it is a skewed demography. So you have a higher number of elderly persons, so obviously there will be a greater risk of death in that group. But we would use the statistics from elsewhere to look at the death rates. because they have larger numbers of cases throughout the demography. Right?
That's why I'm saying that in some other places, the statistics, the death rate is lower.
Right. So we expect if larger numbers of younger people get it, their outcomes will be better, and then overall the death rate will decrease. And that's what we're seeing in other territories.
Let me just come in on this conversation because it's an interesting conversation. Some people are tending to want to get the impression that this is an ailment that is largely only dangerous to older people. Yesterday, I saw this conversation in a foreign country, and the answer to it was, if you look at who have been hospitalized, I think it's 45% of the hospitalized people were under the age of 60. So clearly, you cannot determine that this is an old people danger. We'll fool ourselves if we take that position, and then young people would be cavalier and endanger themselves and endanger more older people. So it is really to be taken, as we had said at an earlier time, that all of us are exposed and all of us could be carriers, and of course all of us exposed to a bad outcome.
And just linked to that false sense of security, the question of wearing masks. Many people may feel they no longer have to social distance, that the mask is a
So our messaging would have spoken to that, but just for clarity, mask is only one measure of protection. It does not give 100%. Depends on the type of mask, it gives varying levels of protection, depends on how you wear it, how you take it off. So masks, together with social distancing, together with hand washing, together with sanitizing, and of course all the other public health measures that we have said before.
James Butler from the newspaper, sir. Just wanted to know, in terms of children who would have tested positive with COVID-19, are there any special procedures or protocols? Would they be allowed to have a parent or a guardian present?
Yes, so the normal procedures apply for pediatric patients. Once you're a pediatric patient, you are actually allowed a guardian or parent to stay with you. Of course, they will have to wear the necessary personal protective equipment while they are nursing the child at all times. And of course, there's an inherent risk of the parent being a primary contact. So they will be treated as a suspected case as well.
Just Rowley from CNC News, right? People who are tested positive, people who are awaiting results for COVID-19, are they kept among the hospital population? Where are they held?
Not necessarily. So there are two broad categories. Suspected cases with very mild symptoms. So you have very, very mild symptoms. They can be sent home. They sign a quarantine order saying that they are to stay at home at all times, pending results. There's another category of persons that would have more severe disease, needing hospitalization without COVID. They are being kept at hospital in isolation to ensure there is no spread until we get a result.
Mr. Yeltsin, just two quick questions for you, sir. There's an alleged memo circulating in the Port of Spain General Hospital indicating that someone had tested positive, someone from the lab had tested positive for COVID-19. I don't know if you'll be able to shed some light on that, perhaps CCNO.
So there were a few healthcare workers in the system that have tested. We can't, as you know, we can't give out details of particular cases, but all protocols are being followed with regards to the hospital. There's a policy that guides healthcare workers as to how to isolate, how to actually quarantine, if there's exposure in the workplace, what sort of PPE to wear. So all those protocols are being followed.
Mr. Nelson, we've seen that in the region, Barbados, some of their ventilators they had ordered had been seized. Have we experienced any that similar sort of thing?
No. So let me explain again. Trinidad and Tobago, throughout the public healthcare system. Oh, sorry. In Trinidad and Tobago, throughout the public healthcare system, we have at any one time 160 to 170 ventilators for normal use. However, for the COVID response, we set up a parallel system to have ventilators dedicated only to COVID. At Couva, we have 12. Then, as I promised some time ago, there was a batch of 25 that came in over 2 shipments. That took it up to 37. And then, as I indicated last week, in Arima, we commissioned 15 more last week. So for the COVID response only, we currently have 52 ventilators. What does that mean in terms of the of the case burden. The data so far, and the CMO will bear this out, is that for every 100 people who get COVID, regardless of age, about 5% will need ventilator support. So if we have 52 ventilators dedicated only to COVID at CUVA and ARIMA, it means we could accommodate, based on the current statistics, a positive number of COVID patients in Trinidad and Tobago of 1,040. We currently have 107, 105. So our current ventilator capacity is more than enough. However, we have been in contact with the government of the People's Republic of China to get in more ventilators. And also, one of the local agents who we normally buy ventilators from Europe is also sourcing ventilators for us during the months of April and May. So as the disease progresses, currently we are oversupplied with ventilators. How many people we have on ventilators now?
Well, during the group of persons, we only had 2 persons.
2.
Yeah.
So that is the rate at which we use ventilators in the public health system. Okay?
But there's a question that follows immediately from that, if I may assist. Doc, since you have the mic, could you take us, as we're talking about concentrating people in the homes, how are we responding with respect to increasing our testing?
Right. So our testing, as Minister would have alluded to, right now the Caribbean Public Health Agency tests for us as well as all their member states. Trinidad is in the process of actually getting our own machine up and running, and we're hoping to have that running in very short order. We're in the process of getting the test kits as well as the extraction equipment that is required, extraction reagents, to actually have those things up and running. In addition, I think Minister would have mentioned previously that we're looking at possibly drive-through testing in a short space of time, which will allow people with mild symptoms to come in, quickly be tested, and then go back to their home. So I think when we look at those 2 things, Southwest Regional Health Authority, the CEO spoke to me today and said his testing, he's going to ramp up his testing as well, his capacity, and hopefully by later on this week, he may be in a position to begin tests once we get the test kits and the extraction equipment that he requires.
About our first COVID-related death in Tobago, and we would have realized that between the announcement of the death to the actual interment of the body, which is the burial, it was a relatively short period of time.
Sure.
I just wanted to know, in terms of protocol, is that normally the best practice to have the body interred in the shortest possible time? Is that something mandated by the state, or was it done at the decision of the relatives?
So no, so that is a mandate of the policy as it relates to disposal of human remains for COVID-19 patients for Trinidad and Tobago, and it is also the policy of WHO that we get the burial or cremation done in the shortest possible time from the time of death.
Dr. Parashar, we continue. I know you all have a position on these 2 trial drugs, or these 2 drugs, but we continue to see in international media stories of success.
Of course.
With
So,
these 2.
Ria, let's be very, very careful. Let's be very, very careful. For every anecdotal story of success, there is scientific evidence of failure. Let us not grab on to every mirage that is out there. We don't have the luxury of that. There is no scientific evidence that chloroquine works, hydrochloroquine, either alone or in combination with azithromycin. There is no conclusive evidence to date that interferon works. However, there is absolute evidence that in Nigeria, 3 persons died of misuse of chloroquine, and 2 persons in the United States were hospitalized for chloroquine overdose. So I am guarding the population that until you have a therapeutic agent that has been tested, trialed, tested, and received WHO, FDA approval, that it is difficult, speaking on behalf of the government, Minister of Health, to expose Trinidad and Tobago to potentially lethal outcomes and potential lawsuits.
In terms of a status on the monitoring of the estimated 20,000 people who arrived in the country, can you just provide an update on that?
Yeah, so...
And in terms of the Quarantine Act, Mr.
Sure.
Seymour, has anyone been charged yet on that?
There's been... Well, we're going to the end of the monitoring for the 20,000 people, all right? Sunday night would have been there 14 days. We're into the 15th day. So in terms of that process, I think we're coming to the end of it. The Quarantine Act, there is a charge, as we said before, $6,000 and 6 months imprisonment. Our preference is really to make sure that persons stay at home and they stay under quarantine, which we have had to do for a certain number of people using the TTPS. So we have gone that way. We haven't gone towards charge. What we want to do is make sure that the Quarantine Act, which is really meant to keep persons that may be suspect or confirmed in a certain confined environment, it has been used for that purpose. And that is the purpose we wish for it to be used for.
Yes, sir.
Just wanted a quick, brief explanation. You said that the Ministry of Health would be taking upon themselves to distribute face masks to the public. Can you just give us an idea of the mechanics behind
Right.
that?
Okay. So we are in touch with some producers of face masks, both locally and imported. The masks that will be given out via the Ministry of Health will not be N95 masks. Those are to be reserved for frontline healthcare workers. So we'll be distributing mainly cloth masks, and we hope that that distribution could start by the end of this week.
The postal service for that? So
No, what we are looking at right now is to do a distribution through the different members of parliament, the local corporations, probably go into areas of high traffic like Citygate, in Scarborough, where the bus services, San Fernando. So we're looking at those methods. We could do that faster than going through TT Post. So those are the avenues of distribution we are looking at. We are now looking to have an NGO partner with us to help us with that.
do you foresee that this may actually sort of counter the stay-at-home, don't congregate policy if a lot of people come?
Well, I think the CMO mentioned that, and it is a good question to ask. The issue of masks are only to be used if you have to go out into the public domain, to the grocery or the pharmacy. It is not meant to be that we are lessening our defenses. Because as we have said from the very beginning, the issue of masks could lead you into a false sense of security. And as the CMO said, it is just one more layer of protection, inclusive of stay at home, distancing, hand hygiene, coughing etiquette, and so on. So it's just one more quiver, one more arrow that we could use. But it should not be thought of by the population that this is a solution and that you could go out now indiscriminately. So I'm happy for that question and to clarify the position.
Now, Doctor, before you leave, as Chief Medical Officer with the authority, could you comment in the context of what has been said here this morning on the whole matter of street food?
Sure.
From the perspective of the Chief Medical Officer.
Right. So in terms of street, prior to the decision today, there was no restriction on any food. Food was considered an essential, and we didn't restrict any food prior to today. Street food doesn't fall as a category by itself. There's itinerant vending and there's non-itinerant vending. Itinerant meaning that someone can move from place to place. Inherently with itinerant vending over the years, those sorts of vendors are slightly more at risk than we have seen from public health literature to public health diseases. And that's the main distinction between the two categories. But of course, there was no regulation in place prior to today to inhibit the sale from itinerant or non-itinerant in that regard.
Yes, Rita.
In the context of Good Friday coming up,
Good.
fishing and the sale of fish on the side of the road, does that fall under the regulations? Can fishermen go out, one, and can they come and sell fish at the side of the road as is normal?
So the regulations as are and the amendments that the Prime Minister has just referred to, fishermen are essential. We specifically add fishermen, agricultural workers, so the answer is fishermen can continue their fishing. So of course that leads to the sale of fish. We're asking the fishermen in the sale of fish. They are not the restaurants that the Prime Minister has referred to that we're now shutting down from tomorrow. In the sale of the fish, please continue to listen to the advice of the Chief Medical Officer and the Ministry of Health. Proper social distancing, proper social hygiene. It does not mean people should go and mass congregate around where the fish will be sold. And as we know throughout Trinidad and Tobago, the vast majority of those places are very close to where the fishermen come into. So we're just asking people to be aware of the personal hygiene, if possible to call in advance to say, look, I'm coming for my fish, because many of these fishermen have their regular customers. When you get there, exercise social distancing, and of course the police will do the best that they can to encourage people to continue to engage in proper social responsibility, which includes the social distancing.
Yes.
Yes, the masks. I don't know if you have mentioned it beforehand, but how long can you reuse the masks?
Yeah, so the masks that we are proposing to be used will be cloth masks. That's a very good question. So they can be washable. So depending on your level of exposure, you've gone out, you could use one per day, you could wash it, you could have 3 or 4. If you're out for a very long time in a very busy environment, you could wear one for half day. But it's cloth masks, not disposable masks, that you could reuse, wash, and reuse.
I don't know if the CMO can assist me just to give me an update on the condition of the child that would have tested positive for COVID.
But again, I mean, we're still trying to single out a particular individual, right? And I would have gotten the question from media off air, and I may, to be honest, in terms of children's health, we give that information to their parents or guardians. So I don't want to single them out.
Okay.
Yeah.
I think we're exhausting that line.
Mm-hmm.
There were other questions outside of COVID that you wanted to ask. If you do that now, please.
So we're seeing the rising tensions between the U.S. and Venezuela. Recently, President Maduro called on world leaders to offer assistance. And basically, Dr. Rodriguez, want to find what's the government's position on what's happening right outside our borders? Is there any sort of concern? How does the government plan to treat with development?
Well, nothing has changed. Our position on the other people's position, our position remains the same. Trinidad and Tobago is part of CARICOM, and we resolutely defend that position, saying that we view the Caribbean as a zone of peace. That has not changed, and we do not expect it to change. So if there are others who believe that it should be different, we don't have any control over that. And insofar as we have any involvement, we continue to reside under the umbrella of the United Nations, where these matters are not one of size and strength, but one of compliance with the rules-based principle, where those rules are determined for all, large, small, big, little, weak, strong, and if the rules are observed, then we should have nothing to fear. But we do have concerns that in today's world, it is not uncommon for the rules to be disregarded, not only here in our region, but elsewhere in the world, and not only between the Venezuelan and other situations, but we continue to stand by the request, the demand, the urgings for rules-based action only. And you know what we're talking here about: non-intervention and absence of military solutions to political problems in this way. So these tensions have come to our borders. We do not have the wherewithal to prevent that, so we simply have to rely on the principles of international justice and international observance of the rules that we have agreed to prior to these difficulties arising.
The Guyana Court of Appeal has stated that the only lawful body to supervise the recount is their election commission. Would suggest, of course, that the CARICOM supervised income would not be lawful. Do you have any comment on the judgment?
I really should comment. I don't want to distract you from our main focus of fighting this virus. But this matter of the Guyanese election is one that must be of concern to us, individually as the state of Trinidad and Tobago and collectively as CARICOM. And there was a ruling in the court of Guyana last week. And I find that ruling quite disturbing, because the ruling was that CARICOM, the actions of CARICOM, were deemed to be illegal. Now, that finding of a court must be of concern to every member of CARICOM, because it would be predicated on an understanding that CARICOM had done something that a court has found to be illegal. And I want you to separate that from the actions of individuals within the context of the political environment of Guyana, the political leaders, the political parties, and so on and so on. The ruling was a ruling that the action of CARICOM was illegal. What was that action? And let me, I'm glad you mentioned it, because I could just draw your attention to, off my phone, to the aid memoir that was signed between the leader of the opposing party, the PPP, the leader of the governing party, the APNU, and those leaders were Mr. David Granger and by Jagdeo. And of course, the third signature to that document was the Secretary General of CARICOM. And I think there was some opportunity for misrepresentation, and that opportunity was seized upon. In the document, in the original paragraphs, it speaks loosely to CARICOM being invited by these two leaders, who are the contestants in Guyana. It speaks loosely about supervising their conduct in counting their votes, where the understanding there was that CARICOM, using its imprimatur, its statute, would be there to see them do what they are supposed to do. And the second to last paragraph is instructive, and I should read it for you. It says that the high-level team that these two leaders asked for to come to CARICOM, to come to Guyana, to see them do what they are supposed to do. It says that the high-level team would supervise the recount under the auspices of GCOM, and would not engage themselves in the actual counting of ballots. Their presence is to ensure that the recount is done in a free, fair, transparent, and credible manner, meaning scrutiny. It specifically said that CARICOM will not engage themselves in the actual counting of ballots. But because the word supervise was used in the sentence before, in an understanding that you will be there to see what they do, by the time it was argued in the court, the outcome was that CARICOM had acted illegally. And I have a problem with that. So now, CARICOM looks on, and we will await the outcome of the developments there. Trinidad and Tobago's position to CARICOM is that, given what has happened so far, given the interpretation both outside and in the court, that if the Guyanese authorities request a CARICOM presence as they proceed from today going forward in counting their ballots or whatever else they do, once a CARICOM presence is requested, that presence should be provided. But in this case, we're recommending that that presence be provided by the same technical team that was there before the heads went to Guyana, meaning that CARICOM is present in the form of expertise from technical people and do not provide an opportunity for this kind of interpretation to happen again. So we'll await the developments there. I have not heard that any request has been made for any CARICOM presence, and if it is made, that is the kind of response that Trinidad and Tobago will support, that CARICOM be present at a level of technical people who will in no way interfere with the electoral process or Guyana's constitution, but would stick to the, just as we thought in the last visit, that had nothing to do with the counting of ballots, but to act as a scrutiny. And there are other people around, and so let's see how it goes. Right now we are awaiting the outcome. Yes, Minister of National Security.
Thank you, Prime Minister. Just to use the opportunity on a non-related topic to Guyana, we're being asked about alcohol and this topic of retailers selling alcohol. So one of the amendments that will be made today is to make it clearer that right now it is only the supermarkets that will be selling the alcohol. So those retailers, the liquor marts, etc., are not meant to be essential services. What we're trying to achieve here, as we've been painfully stating over the past week, is we want people to stay at home. So the regulations will be amended today to say that the suppliers, wholesale suppliers of food and beverages, to the retail suppliers, but not to members of the public, to clarify that, because people are getting into a dispute of all the various types of liquor licenses. So really, buy your alcohol in the supermarkets, and you can't consume it on premises or outside the premises. Please go home and do your consumption. Thank you, Prime Minister.
People who are they are saying that that is unfair to them. But if you're selling liquor, you're selling liquor.
The principle and the policy guiding this, as determined from our medical advisors, the Prime Minister has just announced that restaurants and the service of food via takeaway, etc., will be stopped from tomorrow. Understand that the policy is stay at home. So we're not looking to broaden the amount of people selling. This has nothing to do with economics or the different categories. Thank you, Prime Minister.
Immigration officers.
Yes, I just got that message. There has been a gas leak at the immigration offices on the parkade. So I was just notified that UDCOT has asked that the building be evacuated so they can locate this gas leak from a safety perspective. That is all that it is. And as soon as they locate, they will follow the necessary protocol. So we've evacuated the immigration building at this stage.
They are also saying they have come into contact with suspected COVID cases, and that they are not getting tested, and there's a complaint by the immigration officer.
Okay, this is the first that I'm hearing of it. It is a logical suggestion because, of course, immigration officers would have formed the front line at the time when the borders were still open. And the CMO and the Minister of Health have made it very clear that who requires testing would get that testing. And I see the CMO nodding to me that once there are certain persons who fall into the category that qualify for testing, that will be accommodated. Thank you.
Let me just say this. I tried to say it a little early on, but it may have been missed. Where we are at in Trinidad and Tobago, it is quite reasonable to assume that the persons around you could be carrying this virus. And there's no alarm that goes off, there's no color change that will go on. So it is quite normal then in that scenario that you will have a lot of information by hindsight. Something will happen to tell you that sometime prior you might have been exposed. And it is because of that potential why we are trying to minimize exposure so that what you are fearful of does not come to pass. The other point I want to make is this. As we start to tease out the rope to its finer strands, it becomes more and more complicated. The conversation about who could sell food was becoming or has become a matter of ethnic exploitation by some people who have no intention to help us with this problem, but to create as much money as they could. The regulations never spoke to any menu. And that is why the chief medical officer this morning could have said that we had not stopped these things, except what's happening now, where the CMO is saying street food is deemed to be a problem for medical, the county health, and certain actions will be taken. And the government is saying, given the risk that we are facing now and our position in the marathon, where we are at mile mark, where we are now concerned about community spread, that we are asking that certain closures take place. Nobody spoke about the menu of any particular ethnic group. Restaurants were told, if you're going to serve food, do not entertain people consuming on the compound, and there's to be no in-house dining. That was the position. Today the position is restaurants are to be closed from tomorrow. And those persons who would have been patrons and those workers who are working in restaurants, they will stay home. Because what we want out of all of this, malice to none, ill will to none, what we want is that the individual human beings will reduce their exposure and potential to become infected. That is the objective. And as you see the complaints, sometimes they are diametrically opposed. There are persons who are demanding that we close the country down. The same voice is demanding that we give the people their checks. Now, who is going to prepare these checks and give them to the people who are supposed to get them to survive, to get the food that they need during the period of closure? There are some instances, many instances, where it's an either or. You can't have both. You can't have all of us disconnecting and going to a corner and not come out until the 30th. And at the same time, you want the service of persons to bring relief and comfort to those who are needing that relief. So there will be situations where some people are going to be on the move. Like all our healthcare givers, they are required to be on the move. But if we minimize the amount of people on the move, then we give ourselves the best chance not to get the worst outcome. There are places in the world today where people were at this same point, this same milestone, did not take the kinds of actions that we are taking progressively now. And now, where they are 2 weeks or 3 weeks beyond where we are, there is not a soul in the street, not a soul, except the ambulance driver and those who go into the morgue. That's what we're dealing with. And this behavior of irresponsibility in Trinidad and Tobago, based on the fact that somehow you could escape at the personal level, you could continue to make money, you could continue to defend yourself, you could continue to exploit it, and somehow God is a Trini. You may not want to meet him at this time. Any further? One more? Yeah.
Minister. Minister, based on where we are at right now in terms of data and statistics, can we, at this point, probably map a projection in terms of Trinidad's best case and worst case scenario?
Excellent question. As I say at these press briefings, the statistical data is too insignificant and small to make projections, especially when you take out the 49 cruise ship people. Most countries use two markers. Their first 100 cases, we are at 50 whatever when you take out the cruise ship cohort, and their first 25 deaths. What we have done, as I promised last week, Mr. Kyle Rudden, who heads the local chapter of the Caribbean Actuaries Association. He is working with the Ministry of Health pro bono, and he and his team at the local chapter of the Caribbean Actuaries Association are now developing a dashboard for us behind the scenes so that when we reach a statistically significant amount, that is our first 100 cases bearing the anomaly of the cruise ships and our first 25 deaths, we will have the predictive tools already. We have already set up a working group with Mr. Kyle Rudden and the Ministry of Health to share whatever limited data we have. We are also putting into that dashboard our current epidemiology as far as NCDs is concerned, our rates of diabetes, hypertension. So when that time comes, we are not creating the wheel then for the first time. So that work is taking place in a back room with Mr. Kyle Rudden. The dashboard is being developed. So when we reach that point, we can then start to make predictions.
And there's something that follows from that. And this is where our concern lies. The nature of the problem, the interpretation of the data is such that the facts up to now in all the countries of the world is that by the time you realize that you've missed the mark, it is too late to rectify it. That is the problem. Even with that kind of assistance of scientific data, analyzing your data, if you wait until you can now definitively say, I have reached and I have missed the mark, there is no reversing that can take place. It only gets worse once you begin to realize that. And that is why in Trinidad and Tobago, we take these actions to try and be ahead and not to be able to say, well, we've missed it. And we could have done that 48 hours ago or a week ago. So far, so good. But it's no guarantee that if we don't take the actions that we are taking now, that we can continue to say so far, so good.
There is a report in a prayer group chat that a member of the Parliament staff was affected.
Yes, that's a policeman from Parliament Security has been confirmed as one of our candidates. Where he would have contracted it, I have no information, but I'm advised that there was a staff member, not a parliamentarian, a security officer has been. But again, let us not overanalyze that. He's a member of the national community, and the entire national community is exposed. And that is why it is so unacceptable for persons who believe that they are healthy and free could be taking actions, inhumane actions against persons who may be high-level or low-level carriers or low-risk patients, that somehow you could take action against them in preservation of your own state. We are all at risk. And to go back to the very beginning of this assignment, we are all in this together. It's either we sink together or we swim together. And that is why the government has to ensure that the demands here and the demands there, that the decisions we make are decisions made in the benefit of the wider national community.
Parliament sittings very soon?
No, we don't anticipate a sitting of Parliament very soon. But again, I don't know what may happen that may cause the Parliament to have to meet in emergency. But as of now, we don't have that plan. And we are aiming, even the Cabinet, we are aiming not to have the kinds of Cabinet sitting as we normally would have. We are working on a different arrangement where the Cabinet will function, but under a different arrangement in the very near future.
One final question, the blood bank. What arrangements are being made to secure it, and is there a risk?
So in terms of the blood bank securing, in terms of blood being available, so I have spoken to the registrar who is in charge of the blood bank continuously. She has been in contact with all the donation centers. What we expect to see is a decrease in the number of people donating. So we have reached out to certain individual foundations that have voluntary persons in a large number. So we're trying to get the volunteers at this time to come in. So there's a particular foundation, the UE Blood Donor Foundation, that I'd asked her to reach out to. They have volunteers out of the University of the West Indies. They can come out, give your blood, and then go back home. So we are working on making sure there's enough blood as it progresses. I don't know if your question had an element of safety.
Yes, it's symptomatic people giving blood.
Right. So of course, there can be transfer, and there's procedures and policies in place for any blood that is given. there can be tainting of the blood, for want of a better term at this point, for HIV and other diseases. We have added certain questions to persons before they give blood to ensure that there's a very, very low risk of that blood being contaminated at any point in time. Similar questions in terms of history, travel history, contact with suspected individuals, confirmed individuals, those kinds of things. But tests will also be done as need be for the existing conditions, HIV and the lot as well, as usual.
Okay, thank you very much. That's a good point on which to end this morning. And I simply want to say to the national community that this assignment is far from over. I want to repeat that we do not know of any country that has come out of it. And on the contrary, we expect to be in it for more weeks. And we do not have any alternative response that is deemed to be useful other than to isolate, stay home in order to increase the isolation, stay in, and even as you do so, you maintain the protocols of distancing and, of course, of hygiene. Those people who are going to be at work somewhere in the essential services or the essential caregiving, they will be following certain protocols as well. But the singular line, let us increase our isolation, and that is the only known response to a virus that jumps from person to person. If we do that for a period of time, the expectation is that we will decrease our infection level and be able to come out of this not with the worst case as is possible as we pass each day. Thank you for your cooperation. Thank you for encouraging others to cooperate. And of course, if you see something that ought not to be happening, say something and the relevant action would be taken. And on that last note, I want to thank the police service for doing what has to be done in the area of policing, because some people in our country seem not to voluntarily want to deal with common sense and would only respond to law enforcement. And the police service, like the health service, is another one of our strengths in responding to these demands of the population to be protected from irresponsible people. I do not think it is possible for any person to truthfully say at this time that they are unaware of the requests that are being made of them. It is either you're unaware or you don't care. And in which case, the police will enforce the law under the various statutes that we have been using. And of course, finally, there isn't a law for every irresponsible action that you could take. Be your brother's keeper. Thank you for your cooperation.